Good morning, everyone. Happy Tuesday. Happy Tuesday. Hope you're all doing well. Yeah, you're gonna see me again. So we're gonna thank you, Carlos. We're gonna talk about self-awareness and self-care today. That was gonna be racked in our brain, doing this work. So yeah, we're gonna go into that. And everything just like kind of touches and everything weaves together, like all these competencies weave together to make this beautiful tapestry. And let's share my screen. Let's go with that. Let's see. Share, baby.
Renee, do you want me to share the guidelines or do you got those?
Oh, yeah. Well, yeah, let's start with the guidelines.
Okay.
Second. All right. Let me pick this up. Okay, let's start with the guidelines. Can I get some readers, please? Readers in the house. Let's start with show up and be present. Who do we got that wants to be a reader this morning?
I will.
Thank you. And then Angie, and then, oh, is that right? Is that Mayhem? Yeah, thank you, Mayhem. Go ahead.
Show up and be present. A, notice yourself, what you're thinking and feeling. B, pay deep attention to what is happening within you and around you. C, extend honor and respect by being visible.
And
empower and inspire others by role modeling.
Fantastic. Thank you, Stephen. My apologies. I thought you were Mayhem because I saw you talking Mayhem's mouth moving. All right. So go ahead, Mayhem, Angie, and then Paolo. I appreciate it.
All right. That's okay. Mayhem starts.
Yeah.
Already begins in the morning. It's too early for Mayhem. We're at D or E.
Tell your truth.
Tell your truth without blame or judgment. A, speak from the heart. B, ask for clarification when needed. C, ask for what you need or want. D, choosing silence at any time is fine. E, deal with what's so as it happens. When something happens that impacts the whole, bring it forward to the group. F, keep yourself safe, whatever that means for you. And G, take breaks as needed.
Right on. Thank you so much. All right. Angie in the house. Good morning.
Good morning.
Open. Is it be open or wait?
I think we
tell your
skipped.
truth without blame or jumping. Yeah, tell your truth without blame or jumping.
Did we skip pay attention to heart and meaning?
Oh,
I think we did.
Yeah.
I think we did. Can you do that, Angie?
Okay, so pay attention to what has heart and meaning. A, listen from the heart with an appreciation for one another. B, speak one at a time, honor and value who is speaking. C, honor and use one another's pronouns. D, please refrain from giving each other feedback unless it's requested. If you ask permission or it is explicitly part of the process. And E, pay attention to your attention. Notice what you are thinking when your mind wanders and what you do to bring yourself back.
Fantastic. Thank you so much. Paolo, what's happening? Good morning.
Good morning. So, be open and unattached to outcomes. A, trust the process. B, if emotions are activated, please allow each person to have their experience. In tears come, let the person have them. Please don't attempt to calm, just listen.
Fantastic. Thank you so much. Thank you, Carlos, for doing that, highlighting that for me. Additionally, we request that you make a commitment to confidentiality. What's the Vegas thing? What's said here in this room stays in this room. Hands, show of hands. Here. Right on. So let's honor one another by this process, keeping time agreements. We do our best to try to do that, especially with start and end breaks. Yeah. So let's have some fun. Let's kick back. Let's do this.
So Renee,
Hopefully
if I can jump in real quick.
Huh?
So
go ahead. Oh yeah.
if I can
Carlos,
jump in real quick. So just a few reminders, everyone. We try to uphold, and Carrie talks about CAPS being a learning sanctuary, and that terminology is very intentional here. And so I will be honest with you, a lot of the logistical stuff you see us do, like holding us accountable for being on camera. And by the way, if like I'm picking my nose, it's going to be recorded. You're going to see it, right? If I'm like moving around. And so even though we each are having our individual experience, remember this happens within a collective. right? And so having your cameras on, making sure that we are getting to know you, your faces and your names. Also, those of you that have multiple people at work in the same room, please check the audio before you talk. It gets very, very like painful at times, I'll be honest with you. So this is just to help the process going forward. With that being said, I'll be honest with you. Today, going into tomorrow, is what I call the tipping point in terms of CAPS Academy. And it starts with self-awareness and self-care. We're very intentional on that, but also we're going to get into self-disclosure. So today will be the educational piece, and I will model at the end. Tomorrow, the invitation will be that each of you will have up to 3 minutes, if you choose to share your part of your journey that brought you to CAPS. So I'm just kind of planting the seed because we are going to get deep, and it's not like, ooh, boo, scare you, but it's more of like that reality check so we can, really be present. And as it says in the guidelines, if you need a moment to yourself, you can always send the supporter a private message like, hey, Carlos, I just need to and yesterday a few of you did that. So thank you. That is your right. Thank you, Renee. Back to you.
Yeah, no worries. Okay. And yeah, Carlos is our class support. You need anything, throw him a message in the chat. Yeah. And then, if I don't see your hands too, let us know, like Carlos or something. To make sure I catch everybody has to speak. Also, some of us are still finding our voice in this room. Some of us have our voice. So let's always be mindful, step up. Oh my gosh, did I just freeze a little bit?
Yeah, just a little,
okay.
Renee, but you're
Can
there.
you all hear me pretty good? Like, let me know because I just put my headphones. All right, cool. If I freeze, I'm off. No. All right, let's do this. I'm feeling my coffee's got to kick in pretty soon. Okay, let's do this. All right. Welcome. Thank you for that comfort agreement. Again, my name's Renee Ariano, CAPS Academy instructor for you. Self-awareness and self-care. What's today going to look like? We're going to explore the importance of self-care and coping practices for helping professionals, which is us, peer support specialists, plus, right? Recognize the importance of ongoing support and managing workplace stress. Recognize the signs of burnout, and let's see, recognize the signs of burnout and leverage self-awareness, right, to be able to avert compassion fatigue, vicarious trauma, and secondary traumatic stress. So be prepared to share your strategies with self-care with each other. I always learn something nice from you all. On how to self-care. It's like, oh, that was a great idea. So I love sharing ideas on how you care for yourself. I talked to someone yesterday who was like, yeah, go out and hug a tree. I'm like, me too. I love it. Just being in nature is like replenishing. So that's just an example. So we're going to share our strategies with each other. We're going to learn how to respond appropriately when we have stressors, triggers, which we could say activations, and did indications. So it's like, if you're going to go and do a group, how they say, leave your stuff at home at the door, right? So it's just, we're going to talk about being mindful at where we're at, be honest of where we are at, so that doesn't pour in or leak into working with others or coworkers, and you get the idea. Developing a working knowledge of the concepts of activations and self-management of whole health goals. Okay. And then we're talking about how to take care of ourselves here as peer support specialists going into this field. It could be pretty interesting. It could be pretty, we know how to, I think in this rule is we pivot a lot. We got to pivot a lot because how many hold on, I can't even see everybody. How many of you know that, working in the field, that when we have a schedule, it usually doesn't go like that, right? We always got something. So I always say, whenever we get new hires, I'd be all, welcome to the jungle, baby. Welcome to the jungle. Anyway, so let's do this really quick. Am I still sharing my screen? Yes,
Yes.
I am. Okay, cool. So we're going to learn some things here. Why can't I do this really quick? Let me see. Sorry about that. Okay, let me share again. All right, cool. So self-awareness and self-care, again, you're going to hear this a lot today, right? So So we're going to talk about how it relates to our personally, as well as our role in this field. So self-awareness gives us a chance to tune in, right, to what we're feeling, what we need, like our needs, and how we can best care for ourselves. And then so either you do it or you don't, right? Self-awareness gives us a chance to tune into what we are feeling. And self-care is the bottom line. Without having self-awareness on what's going on with us, then we can't do any self-care, if that makes any sense. Especially when you're, if you deal with depression, we're going to deal with a lot of people that like, maybe a lot, but you're going to hear, we're going to deal with people that have that depression and just no low motivation, and we're here to like pump them up and share our story and help them, sharing like what we do for ourselves to help them. I like to say this: check yourself before you wreck yourself, right? Because we really have to be aware. All right. So it all starts with us, right? We have to have a good place in our recovery, physically and mentally, not perfectly. I know, like I have to work every day with my mental health, my spiritual health, all that good physical health. We're talking about the 8 dimensions of wellness. To be able to be an effective peer support specialist, it's important to be able to present ourselves with effective coping strategies, to be able to take care of ourselves and that be an example to the people that we're working with. For instance, if you're let's say something's going on, we talk about life gets messy. We have a leave of absence, for you for this cohort. If you find yourself swimming, you're like, man, I really can't give this my all. And you're being honest with yourself. We do a leave of action. That's taking care of yourself. That's being aware, right? And you're taking self-care. It's like, okay, maybe I'll come back the next one, so you see how that works. But yeah, so our role as a peer support specialist, Cal Mesa, we have the skills to manage our own condition, effectively support others, a peer support specialist. We need to be in a good place, recovery, mentally, physically. Gosh, I feel like I'm repeating myself. And successful at self-management. I'm telling you, even going to school in the psych tech, they're like self-care, self-care. I'm like, what are they talking about? Oh boy, did I find out. They have knowledge and skills, self-management, essential. This is essential for our role, even in the working field, period. So right with that, we're going to get into a little meditation to prepare. Feel free to turn your cameras off. You could do this. One time I was totally into it and I didn't realize my camera was off. I was like, oh my gosh. But anyway, I get into this stuff. Feel free to turn off your camera if you're daring like that. You can leave it on. But let's do this a little bit. It really does help. And this is also a good tool to use with people that we're working with. Let me know you can hear.
Welcome to today's guided meditation in honor of World Mental Health Day. In this meditation, we are going to take time to check in with our body and energy and give ourselves the space we need to heal. Begin in a comfortable position with eyes closed. Connect with your breath, feeling the gentle rise and fall of your chest, the expansion and contraction of your lungs. Breathing in and out. Take a moment to do a scan of your body, paying attention to how it feels. Notice any discomfort, pain, or tightness. Notice things that feel good as well. Start at the very top of your head, breathing in and moving down your body slowly as you breathe out. Down to your chin, to your neck, and further down. Take note of how your body feels, but don't dwell on it. Down to your chest, your stomach, hips. And down, down to the very bottom of your body. Take a deep breath here. Feel yourself grounded and stable in your body. Breathe deeply. Take the time out of your day touching the earth for a moment, or making yourself a nice hot cup of tea. Connect again with your breath, feeling the gentle rise and fall of your chest. Feel the heat of the air as it exits your body. Breathing in and out. Move about in any way that feels good, slowly coming back to your body in this time and space. And whenever you are ready, slowly open your eyes.
How's everybody feeling? Was that helpful? So let me ask you this. What was the difference from the breathing we just did versus the breathing we regularly do?
Gosh, I was totally talking to myself right now.
It's okay, Renee. I wasn't sure. So,
Oh my God.
Nico, go. I just asked them, Renee, what the difference was between the breathing we just did now versus.
Thank you.
Okay,
Thank
go ahead,
you.
Nico. Go.
It was more intentional for one. It was really helpful to be able to like envision like your breath work going down through your body, like a mindfulness technique.
Oh yeah. Thank you.
I noticed that it took more focus to make sure that I was like breathing the right way, like what you're trying to say, because I never pay attention to my breathing.
Yes.
So I had to really like make sure I focus and pay attention to every detail that they were saying. And that was different.
Yeah, thank you. Thank you. I'm all talking to myself. I didn't even realize my camera was off. I'm like, oh my goodness. I just I was gonna say if you're not used to this, it could be very painful. Because I used to be after like 40 seconds, I'm like, screw this, can't do it. But like you said, it brings you like that compared Carlos's question that, what was the difference between our breathing regular this morning until right now? It's the mindfulness, so we could use this as a tool. Think of it, you're getting in there, leave our shit at the door, they say, excuse my French, you know what I mean? Leave your stuff at the door. And if you can't, this is a really good exercise to really do some grounding. I got tapping, so I'd love to share some resources with you. Let's share with each other what you may do. I'm sorry, Evie? Is it Evie?
Yeah, it's Evie.
Oh, Evie. Okay. I should ask first. My apologies.
That was good. I think the intentional like silence or lack of distracting sound is really nice, because how often is it that there's actually like quiet around us?
Yes, I love that. I don't know, that makes me, I don't know if I'm a little off with this, but it makes me think when I sleep, and if there's any light, it's just like if it's completely dark, I'm like, who's, you know what I mean? So that's how I thank you for that. All right. What's up, Jessica? Jess, what's up? Good morning.
Hi, good
Smile.
morning. Hi, good morning, everyone. That I don't always do these exercises, but today when I did it, it helped me be in tune with my body physically, and I was able to realize I'm aching a lot, and I don't really realize
Oh,
that when,
yes.
going about my day. So it helped me be in tune and hopefully encourage me to, attend to those things and take care of that physically too. Thank you.
I love that. It's like getting in tune with our body, like, that whole mind body connection. Like, we don't realize we store a lot of emotions in our hips. I don't know if you all know that, but I've done some yoga where we do, yes, right? I've done some yoga where I just do these positions that open up your hips and I'm crying. I mean, all this emotion comes out. Let's do Maggie and then Zai. I'd love for you to share. Great. No, no. Oh, okay. I thought I'd say great color, but by the way, that maroon. Ooh, I like it, burgundy. All right, Maggie, good morning.
Hi, good morning. I feel relaxed.
Yes.
Yes, I closed my eyes and I just pictured myself in the mountains and just sitting there by the stream of the water, and I was getting sleepy. It's like, wait a minute, I need to wake up. We need to wake. Yes, right here. Coffee too. Gotta have
Heck yeah.
coffee. So,
Yeah.
yeah, I try to, breathe a lot, since I do work with a lot of people that deal with mental health, substance abuse, and domestic violence. So I, depending the cases and what I'm going through, some of them, are the trauma kind of arises at times.
Oh,
So
yeah.
between clients, I try to go into one of the interrogation rooms and just breathe.
Yeah.
I breathe and try to calm down. I don't get like that every day. It's just, sometimes some days are better than others. Some cases are stronger than others. So I try to implement, before I talk to clients, I try to work on my spirituality before I even talk to anyone, because I need to be grounded
Yeah.
spiritually before I talk to anyone. So when I'm dealing with clients, I do exercise the breathing because I notice that it does help me, and I try to kind of disconnect from that client to focus on myself and then move on with the next client.
Fantastic. Thank you. Thank you. I've also worked with DV. I was thinking about it. Actually, I thought about you. I worked in a domestic violence shelter. Of course, I went through the shelter myself and it's like, I want to give back. So I became a domestic violence counselor. I went through my whole drug substance use stuff, doing my walkabout. I'm going to be a substance abuse counselor, all that good jazz. But I do realize when I was doing domestic violence, I gained 60 pounds and I was just the stress was gnarly. So I knew I had to step back from that piece, but then here I am working in the locked facility. It's pretty wild. So this is why I'm so big on this. But, myself having, CPTSD, I have a little bit of OCD, I have ADD, I have I live with bipolar. I've also had 2 brain tumors. So I'm a happy mess right here. But I love what you say to ground yourself before you're going to interact with others. I have to say, like, what I do is I do a little prayer. And what I do before I meet anyone, even before I meet you all, I bless you all with happiness, joy, and laughter. I mean, you just put it out there and it comes back to you. So I hope you all know, like, that's just works for me. And when I work with people, I just want to make sure, I have that good energy going on. And when I'm in a funk, I got to realize it. You know what I mean? But anyway, we're all talking. Let's keep going. Am I still sharing my screen? No. Thank you, everyone. So this is good, good tools. Learn some of this stuff, pass it on. If you're interested in learning more, let me know. This is good stuff. All right. So now to be an effective, right? To be effective in our work, we have to have a good knowledge of this stuff right here. Let me see. I love seeing you all. So I'm going to put you there. All right. So the role of peer support in activation and teaching self-management, right? Activation, you maybe have heard that also is triggered, right? But we're trying to move away from that. And instead, this is where we're going to, learning all this, that we're going to start taking self-awareness comes in instead of, for that activation. And remember, we don't tell others what to do. right? We may not agree, but we don't tell them what to do. We support and we encourage them. We're person-centered and recovery-oriented. So, I'm a subject matter in psychiatric rehabilitation, and I cannot wait to share that presentation with you all. So think of your role as a professional that's walked in that person's shoes, right? We're the ones with lived experience. Oh, I know someone was like, oh, what's a peer support specialist? Someone's like, oh, you're that person with lived experience. I thought that was pretty freaking cool, right? What if we were certified people with certified lived experience subject matters or something like that? That'd be kind of cool. So your role, right? We walked in their shoes. So kind of like us, people with lived experience. Our role now is, peer support specialist. You're going to be certified by the state of California. Is going to be a beautiful thing, right? So high level activation, whoop, whoop, thank you, Nico, can refer, right, that heightened sense of alertness, right? Or it could be readiness and engagement. Because I heard, like, when you have that stress hormone in your body, we start stressing and freaking out. Actually, our brain doesn't realize the difference between that kind and getting pumped up before a game. You know what I mean? Getting pumped up before a race, before a basketball game, whatnot, whatever you're into, how you get all pumped up and it's that same adrenaline kind of thing. We can actually switch it if we're mindful. Someone very wise told me that, and I was like, wow, this works. Right? So, to be ready, be alert and engage, whether we have that physical, mental, whatever setting that we're in, we're able to still manage our own conditions, right? We're still able to manage our own, things going on, which is going to increase to our self-management. So we help people cope, right? We teach them better coping skills, so we can move on and, keep on going, right? What does that say at the last presentation? To get a life, we're going to get a life, get back into life. Our spark, our light's going to be, relit if you lost your spark. So we don't tell people what to do. We empower them to do it for themselves. Remember, we don't empower people. We empower them to empower themselves. All right. So now we're going to talk about behavioral activation. So this is where the relationship and what we feel and what we do and how we feel. And what does this look like? We talked about, I think it was something like yesterday about, when a challenge comes up, shit goes down, we could take a stop, breathe, and try to take the opportunity out of it, right? Because how do we learn? By making mistakes, for sure, right? I mean, if we were all perfect, we wouldn't be growing and learning. So we often learn from mistakes. Just like we talked about, people, what do you do if we do this? What do you do if you do that? We don't know until we're in that position and we experience it. So there's just opportunities. Try to look at them, opportunities for growth. And then, like, I don't know about you, but when we're in that funk, depression, man, not a good place to be, in that darkness. But, you're just not feeling well. We may not get up and take a shower. We're laying in bed, not combing my hair, not doing my skin routine or whatnot, not going out and engaging, not going out and dancing, not going for my runs in the morning. Like, I know something's up, right? So when we do something, we're sad and we're lonely, we're low energy, we're not doing stuff, right? I used to have a sponsor and I'd call her and I'd be so messed up because, that phone is like 500 pounds, those cliches in recovery. Really picking up the phone was really hard because I tended to isolate. I was the isolation queen and wouldn't answer my phone, just feeling, sitting on my pity box. But anyway, so, what do we do? So if we're not thinking about a better way to behave, we're just kind of stuck in that. It's about getting into that thinking and that feelings. We got to change our mindset. So here we are feeling like crap, right? And then all of a sudden it's like, oh, we got to take that step to do something that we enjoy, right? Do something that you remember you enjoy. Like when I'm working with others, like I'll listen to them. I'll get an idea. Maybe I'll see something on their shirt. Maybe it was from a race. Hey, you like to run? Just little things like that you pick up on that they enjoy doing, that someone would enjoy doing. So therefore you might activate that. So do more of what makes you feel better. And then eventually you keep doing it and you feel better about yourself, right? So we talked about hope, having hope. And then there's that recovery where we're learning like, whoa, okay, this is what's going on. And then we got the wellness, the 8 dimensions. So what are we going to do with that recovery? we're going to learn how to do those things that we enjoy that make us feel better. So what are we doing every day what are you doing every day to take care of yourself? Let's see. I want to hear from someone I haven't. Carlos, what do you do every day to take care of yourself? Let's hear from our other instructor here.
So I'm huge on movement, y'all. And and movement doesn't have to be like running is my release, but walking is my favorite. And so for me,
sorry.
so one of the things that I've learned, if I sit for too long, my energy drips. And I'll get more into my share later. So for me,
Yeah.
any kind of movement. So during breaks, I get up, go to the restroom, just trying to get my body going because I think we just get stuck and then it's actually really unhealthy. So thank you for that, Renee.
Yeah, no, thank you. Gosh, I don't like picking on people, but I really am curious about others. Mars, look at I always see you wear a hat. I didn't recognize you for a split second. What do you do to take care of yourself? Like what keeps you going? If you don't mind me, you don't have to answer.
No, I love it. If I can do it every day, it'd be beach hopping. But most of the time, that's what I would do. Like I'm in Long Beach.
Yeah, baby.
But something more accessible would be writing.
Oh, that's good.
Yeah, just writing and putting all my thoughts just on a piece of paper or then turning it into a song.
I like it. I like it. I'm gonna have to visit you with a guitar.
Oh, let's do it.
I'm just kidding. I'm just practicing. I don't know. I can do the drums though. But right on. Okay, one more. Heaven, look at you in some brown today. Usually I see you in white. I'm very observant on weird stuff. So hi, what do you do for self-care?
Hi. So taking time at the end of like each day, I check in with myself and think about like what I could have done differently or what areas I need growth and nurturing.
Awesome.
It's a daily check-in.
Yeah.
Thank you.
Thank you. I have one more person I want to ask. David Bautista. Did I say that right?
Yes.
All right. What do you do for self-care, if you don't mind me asking?
I like to spend a lot of time outdoors. I feel like just isolating myself indoors kind of causes a lot of anxiety. So I just like to go out for walks, go out for a run, just get some fresh air.
Ooh, I like it. I like it. I dealing, like I told you, I worked with people with a lot of social isolation, Even it's like, hey, let's go for a walk down the street. You want to go for a walk? Let's go to the liquor store. Let's go get some gum or whatever, let's get a soda or something, like just to get out and go for a walk. Because even working with people, like they're all upset, something's going on. Or I don't know if any of you are that one that something's going on, going down. Something's disrupting and they're like, hey, Mars, can you go talk to them? Are you that person? They're like, hey, Paulo, can you go talk to them? Jose, you're the one, go talk to him, And it's amazing when that happens, Anyway, I could go on and on, but thank you for sharing. Let's go. How are we good on time? All right. So here's a little example of behavioral activation right here. Can you hear it? Oh, it's loud a little.
I've never been a really active person. I don't like sports, I'm not in band, and I'm not really in any clubs. So at first, I didn't even notice when I started to withdraw. As things got worse, I stopped hanging out with friends. Then I quit my part-time job. I stopped sitting with anyone at lunch, and finally stopped leaving the house unless I absolutely had to. When my depression was at its worst, I almost never even left my room. One of the main symptoms of depression is a loss of interest in being active or interacting with people. This can make you stop doing things you used to enjoy, and the more you withdraw from those things, the worse the depression usually gets. One coping strategy that really helped me break this cycle and get back to my normal self was behavioral activation. To do behavioral activation, I chose and planned things that got me moving and forced me out of isolation. The goal is to get out of the downward cycle and start doing things that will reverse it. Like, I used to enjoy taking my dog for walks while listening to music, but when I was depressed, I never fell up to it. It was a big step for me to schedule time every day to walk my dog and really commit to it. At first, I just walked him for a few minutes, but I made sure I did it every day. And I rewarded myself each time with something small, like listening to my favorite song. To be honest, it wasn't even fun at first, but I stuck with it, and after a few weeks, I actually started looking forward to my walks again. I also pushed myself to reach out to a few friends and eat with them at lunch. It seems a little backwards, but by doing things before I felt like it, I slowly started to enjoy them again. Now, I try not to wait until I feel motivated to do something active or important, because I know that staying in my room will just make things worse in the long run. Behavioral activation seems really simple on the surface. Plan some physically active tasks and then do them. But when I felt really depressed, it was almost impossible to do things that used to be fun. For most people with depression, it's important to set small goals and reward any successes. For me, it was also important to do the tasks consistently, even though I wasn't enjoying them at the beginning. The upward cycle of activity can take time to get going, but it can have a big impact on your life if you stick with it.
So you can see how that works, right? We just gotta do it. We just gotta do it, when you're ready. Almost like when I'm feeling depressed, if I'm not running, like that's my outlet as well. If I'm not running, something's not right. So what I have to do is put my running shoes right next to my bed, have everything ready to go, get up, put the shit on, get out the door before my mind realizes what my body's doing, and then I'm always like, thank you, and it's so wild because I see the wildest shit. I mean, stuff out here in Long Beach. And I'm like, if I didn't go for a run, I would never have seen that. Like, just cool stuff, cool stuff. But yeah, we gotta sometimes just push ourselves to do it. Carlos, what you got?
Yeah, Renee Maria Sosa in the chat is asking, what if you have a hard time doing any of this stuff? What do you
Oh,
recommend?
right. If we have a hard time doing that, whoo, I'd say get a piece of paper and pencil, write all the things that you enjoy. I personally would sit with someone and be like, all right, let's write all the things that we like to do. Maybe, reach out to someone. I know that's hard too. Reach out to someone that likes the same things. Something, you just have to do it. All I could say is just do it. What's the worst that can happen? And it is hard, reach out, call me. I'll give you some motivation. Call someone that makes you happy, get pumped up by something. Everyone's different, and I guess if I were to know like who you are and what you like, I'd love to get hang around someone that knows you, that could be like, yeah. But I know, again, it's hard when we're not feeling well and don't want to pick up that phone. So I don't really have a clear answer. I love this is an opportunity. Does someone else have something else? I'd love to. Oh, Zai, what's up? Let's hear it. Let's get some feedback.
I was going to say, I definitely resonate with the writing things down tip, because it's very helpful. I try to put it in like 3 categories of like stuff I guess need to do, stuff I want to do, and then stuff that I want to do but also doesn't involve a screen in any way. So I'm like disconnecting from like any screens or anything like that, just because that's always very important. And I would just say, and then make I guess if you like the smaller stuff, it's just like what's like a small thing you can do. Like I like coloring in Crayola pages and stuff like that. And what's it called? That doesn't take much of anything really. So what's it called? Yeah, it's just like giving you something to do, and also it makes you feel accomplished because you have something literally physical to hold up and be like, yeah, I literally did this, and I like it and stuff like that. And so just having something like tangible that you can feel and stuff like that is always really important. And yeah, just like starting small, I would say. I would definitely.
Ooh, I like it. I like making lists. It's like, okay, go outside today, draw 5 pictures today, and if I don't do it and I at least got a couple, I circle them and I add them to the next list for the next day. You know what I mean? Like that makes me feel good if I get 1 or 2. Thank you for that. Ooh, Haley, good morning. Hello there. What you got for us?
Good morning. Well, for me, especially when I was watching the video, how he said it's best to like do the stuff even though you don't feel like doing it, and like keep doing it till you have that spark back. I relate to that because like I always like right now I like writing, but like I haven't been writing because I didn't feel like it, and I always say to myself, once I feel like writing, then I'll do it. But like I don't feel it most days. That's my favorite thing to do. But so what he said, like just keep doing it, and even though you don't feel like it, and then you start enjoying it, that really resonated to me, because I didn't even think about doing that, like force myself to like do it. That's why, and that's the way I can get my passion back. So yeah, I'll do that. I'll keep that in
I
mind.
love it. Oh, thank you. I love that. All right, Stephanie, what's happening? Wait, do we usually call you Stephanie? You have a nickname we call? No?
Stephanie.
Okay, Stephanie. I was just wondering. Hello there.
Yeah,
Thank
hello.
you.
In my worst depression, the hardest thing was getting out of bed. So I started really small by a shower, and then washing my hair and putting some makeup on. And it was almost like putting some armor on. And then I felt better because I felt like people didn't look at me like, ugh, you know? So that's my really small start when I'm having a super bad day. From there, I go on, and then I do animal therapy. So I go out with the animals, do the other things that bring me joy. But on those rough days, just taking a shower, that's my self-care. That's feeling better and easy to do that much.
Ooh, I love it. I just think Maslow's hierarchy of needs, like that first pillar, you know, your basics, air, food, water, all that good stuff. How many of you heard of HALT in recovery? Hungry, angry, lonely, tired. Give yourself a self-check. Am I hungry? Am I lonely? You know, like it's like, oh yeah, right. So Maria, that was your question, right? Were you the one that asked the question? Is that correct? Sosa?
Yes, I did.
All right. So can we, like, what do you think now that you got some couples? Was that helpful?
Yeah, I do relate with the young lady that was sharing before me. It's crazy because I have a really hard time like getting up, you know, and I sleep late, you know. I sleep like at 2, 3 in the morning sometimes, and then, you know, and this is like I don't know if it's well, obviously it's lack of motivation, you know what I mean? Sometimes like I've never been like this, you know. I used to be a you know, I was the type of girl that would wake up happy. You know, maybe it has to do with my mental health, you know what I mean? And I haven't been taking care of it, but it's like I usually wake up happy, eat something, do my makeup, and now it's like it's a hard time for me to get up. I don't put makeup like that no more. I used to like I'll get all dolled up, like literally. This was not my face, you know, and now that I'm sober, you know what I mean? Like it's just hard.
Yeah.
It's hard, you know. So it's like I really do appreciate, you know, everybody sharing what they're sharing. It helped me. I don't want to cry, but it's like it's hard to get up.
It's not easy. It's not
That's
easy.
why I asked, I'm like,
No, please do. I'm glad you did. I didn't mean to put you on the spot. I think that's beautiful.
Okay.
And it's beautiful that you're sharing. And this is beautiful that we're doing self-care, self-awareness today, baby, because you're going to learn some coping skills. We're going to help you out. You got us, you know, get some numbers, reach out. We got you. And you know, it's so wild in recovery. I don't, you know, in the beginning, we start feeling, and it's not easy and it's not fun and it's uncomfortable, but that's where the growth comes. So let's move forward. I see other hands. If you don't mind, put it in the chat, just for the sake of time. But thank you for sharing, and everybody, think, you know, giving our 2 steps, our 2 cents to help out. So with that, oh, I love that. 1 step at a time, baby. It's so cliche, but it's so true. All right, okay, I'm not sharing my screen here. Let's see. We're going to go into a breakout room. Carlos, giving you a heads up now. So right here. So I'm interested. I mean, we talked about it, right? But we're going to talk about your style on how you're going to practice the technique of activation when you're going to work with someone, when you're going to approach someone. How are we going to do this, right? So here's an activity I want you to think about, right? As a peer support specialist, what strategies would you use to encourage? This is perfect. This is perfect for you, Maria. I mean, this is, you know, anyway, working with someone that they report that they're having, like, they're sad, lonely, tired, or isolated, maybe hopeless. So as a peer support specialist, this is so great because we talked about this. How would you approach this activation to be able to activate that person? Just think about it. How would you, you know, that person's lights out, their flame is out. How can we help them light that baby? I guess that's the way to look at it, right? So we're going to talk about what would you do with your partners. Okay, we're going to probably do, we're going to try to do our best of rooms of 4, breakout rooms of 4 for 10 minutes. So what would you say or educate or empower this person? Write down what you would do and say for each behavioral health steps, for these, for instance, to encourage, to be active listening, think about goal setting, positive resources, educating, providing skill development, all the stuff that we're here to do to help others. Encouraging them, empowering, helping empower them, to empower themselves. So let's get, and this is so perfect because we just did a practice example right now in a sense. So we're going to get into rooms. We're going to, have someone be a scribe to write down and pick someone to do a report out. So pick one of these things as someone, for instance, Mary, I hope you don't mind. Where are you? I got to see you all. If we use that as an example, where are you at? Is that okay that we use that as an example? But okay, so this is perfect. So what we're going to do, so this is exactly perfect for this. So how can we help activate sadness or fatigue? Does everybody understand this assignment, what we're going to do?
I do have a question.
Yes,
Are we
Nico.
supposed to do it for every instance, like smoking,
No.
obesity?
You're
Okay.
no. Thank you for that clarification. You could pick one. Okay. Everybody get together, pick a scenario. Maybe it could be yours, share. Someone could share theirs, and let's work together on how we can do this. And how would you? I want to know your style, how you would approach this. We already heard a few beautiful ones right now. So, 10 minutes, Carlos.
Yeah, we're good to go.
All right, and then we'll take a break when we get back, and then we'll debrief. Sometimes we don't have enough time, or we have too much time. It's all good. Nicholas, I love your background. Woohoo! Feels all
Thank
spacey.
you.
All right, Carlos, want to take a listen? Go ahead.
Say that again, Renee?
We're
Sorry.
going to take a break. We're going to take a break for 10 minutes. Fantastic. Right on. All right. So kind of lost my groups here. All right. Room 1. Do you remember what room you were in? Because I don't have my breakouts. Room 1. Room 2. All right. Who's the reporters? Report out. Any room. Anybody. Any takers. Thank you, Maggie. What do you remember what room you were in? We had some
I
breakout
believe it
rooms.
was room 4.
Fantastic.
I know it was a young lady, blonde hair. I forgot her name. It started with an A. And then let me see. It was Angie.
Okay.
Angie, there you go.
There we
And
go.
then the other gentleman, I can't find his name.
Where
He
are
was
you
really,
at?
really nice.
Woo, Paulo. All right.
Yes, lovely individuals, wonderful people. I learned a lot from them. And we shared a lot about diabetes, how we have our own shares with, helping people with that have, that uncontrolled diabetes. And it's really hard when they don't want to listen to suggestions, because my husband's diabetic. And at times, we kind of bump heads. I'm like, look, you've had too much candy. I already counted. And I already counted how many chips you had. Because I want him to hang out a little longer. You know what I mean? Like, I want him to hang out a little longer. And I do things because I care, not because I want to be bitchy or anything, but I want him to be healthier. So my part as myself, I'm implementing more greens in my foods to make sure that, his sugar is stabilized. Yeah. And
So
of
what
course,
is
not be.
educate? Yeah. Oh, no. I
and-
totally get it. But so what is
And
the
of course,
educate
not stress him
empower?
out so his
Oh,
sugar won't go up.
He's like, damn, she caught, like she counted another chip. But anyway, so education, right? We want to encourage and empower. Anybody else from Paulo or Angie? We good? All right. Latte and then Nico. Latte and then David. Do you remember what room you were in, Latte? Was it 2? I saw that you asking.
Yeah.
Right? Okay.
It was either 2 or 3. One
It's
of them.
all
I
good.
don't
We got
remember.
it. We got this.
But
Thank
what we chose to do was isolation. And Daniel was in my room, and I forgot the other people's name, but we had some really good people in the room, and we chose to speak on isolation. And some tips that we said that we can encourage is by taking small steps like doing Zoom, because at least they're in the comfort of their own environment, but then they're interacting with other people through Zoom. And then once they feel comfortable going out in public, maybe they can go to places where people are around, like the mall, and just walk around the mall, or going to the park and walking around the park. We also said connect to people that they feel comfortable with, like family members or friends, and just do a small meetup, like maybe just meet up for coffee at Starbucks instead of doing like a long lunch date, that could be overwhelming. Just meeting up at Starbucks for coffee
Perfect.
first or whatever, and just
Right
do
on.
little steps like that.
I love it. So educate, you're empowering them, taking them out, giving them an opportunity. Love it, love it. Really quick afterthought on the whole diabetes thing. I used to do education on my nursing with diabetes, especially with taking your medications. And what I would do, because they love soda by the gallon, so I would go online and show them how many spoons of sugar in one soda, and it freaked them out. So it kind of worked, but you know what I mean? We got to be creative.
Thank you
David?
for that.
Michael, yeah, for sure. Show them online what it looks like. And then Eddie.
Hi, yes. I don't remember the room number we were in, but I was with Stephanie, Heaven, and Maria.
All
And
right.
basically, we kind of just acted as the role of the peer support specialist, take just adhering to a client that has or struggling with obesity. So
Yes.
basically, we said that we would start off by just asking the peer how they're feeling, just to uncover any underlying feelings. I gave the suggestion that it's very hard sometimes to express one's own emotions. So we could start off by saying, if you don't know how to express it, you could start off by just writing it down. And from there, we could go ahead and debrief. And after we like debriefed all the emotions that they may be going through, we asked them to create measurable goals. So we could start off by maybe starting off for taking 500 steps a day, creating structured meal plans so they know how to, just so they have something tangible and they know something to follow, just to create that structure. And we also wanted to offer a relapse plan with resources or maybe some friends that they can reach out to when, in any case, they do relapse.
Oh, I like that. I like that. And the one with the diabetes, going back to tie off on that, we were giving out little pedometers. I think they still call them that, right? Where you put the little clip on, it counts your steps. So that was a good segue to be like, yo, check this out. I love that. So do you see, I had the educate and empower, because we're going to work it. Thank you very much. Mike, how's it going? Good morning.
Morning.
Hi.
Again, I think like most of us, we forgot our room numbers, but I was with Zai, Alexander, and Isabel, and we took on the topic of smoking addiction.
Okay.
Basically, that when we're talking with the consumer, talking about things are beyond their control. It's not a shame if they have a relapse. Going cold turkey is hard. It's definitely not easy for most people, and just saying that they should not feel like it's a personal failure if they can't quit the first time or the second time, which leads, they have to take small steps to make this happen, right? It takes time, and, work their way to sobriety. We also brought up going off personal experiences. You want to share that you can relate to the consumer. So there's some validation there between you and the consumer. And then just talking about courses of action that they can take, such as using nicotine patches, nicotine gum, finding other objects to replace the cigarette in the hand. Things that come to mind for me are like lollipops or something that's in their hand. Yeah, something with the mouth.
Right on. Yeah.
And then also talking, with them about the health effects, discuss health impacts, wealth impact, family impact, secondhand smoke. Provide that education and the resources, emphasizing the consequences if they don't follow through with their actions. And also state, you minimize that you want to minimize the damage and harm to their bodies and people around them, because it's not just the individual addiction. It impacts other people, right? Secondhand smoke.
Yeah.
And then, you want to give the consumer the power to make those choices, because if we do it for them, it doesn't work. They have to own it, see the end result.
Ooh, I
And
like that.
provide realistic support. That's what we got.
I love it. A lot of education, a lot of empowerment there. Oh, I love that. Yeah, I used to say they feel so bad. I work with someone, they're doing so well. They're like, I had someone just totally devastated. I don't want to let you down, blah, blah, blah. And I'm like, hey, dude, that's a part of that's all part of the stages of change. It's part of the process, one step forward, two step back, let's keep going. They're like, okay, let's just keep on keeping on. Nobody's perfect, but look at, we give them like applaud for how far you've done. Look at this. Let's keep going. Don't stop. I so love that. And then also that's harm reduction. I don't know if any of you are very familiar with harm reduction, but right there, giving them the lollipop or the toothpick, that's harm reduction right there, baby. And you're going to get more into that with Guyton. It's a beautiful thing. Right on. Evie. Oh gosh, I'm going to ask you first.
Hi.
Pronouncing your name.
Evie. Like
Evie. Okay, I'm gonna write that down really big. Okay, Evie. What's that?
Like the Pokemon.
Oh.
Yeah. So our group number is obscure.
It's okay.
I was with Nicholas and Laura, and I forgot the last name that was there, but I really I also heard someone else say that like we created like a general outline, basically to help someone with like hypothetically like addiction.
Okay.
A seemingly seemingly incomprehensible force, that an individual may be going through. And we break it down into something simple, like with the first step being provide a safe space physically. So, allowing them to have a quiet space so they could focus on the true nature of their own thoughts without the external stimuli of like, I don't know, the city or maybe their home life. Or like someone else was saying, create a Zoom meeting so they could enjoy the comforts of their own home. Maybe with something like addiction, maybe you want to get them out though. Just because like, activity and the movement, it's all about the little things. And once the space is created, the safe space is created physically, we can allow for an emotional safe space. We can allow for, true connection, make them like, let them know they're safe here, that we're not going to criminalize them for what they've been through, like show understanding. And then once we have the physical safety, once we have the emotional safety, we can get down to like maybe the nitty gritty of setting goals, and like, as opposed to like accomplishing a hard and difficult task. On the web. Maybe break it down into like individual steps. Like, if you want like to move to somewhere really beautiful, the first step isn't just, maybe it is just going there, seeing the place, but the first step often isn't just go buy a house or something. It starts with something simple like where, like location, where would you work? Where would you live? Like, what do you like about the place?
Yeah.
Or with an addiction, like, sorry, like got sidetracked, but like with addiction, like maybe just replacing all the bad habits with good habits. And it's obviously not that simple, but once
Right.
you find the safe spaces, it becomes a lot more achievable.
Absolutely. Thank you for that. There's a lot of empowerment and education there. It's small steps turn into, they start compiling and turn into one big one. I love that. The whole comfort, giving them a safe space to feel safe. And that's where the trust, where you build that rapport and that trust, they're going to be honest with you. I know, you know what I mean? When they start getting honest with you, they want to start talking. How many people are you with? People come up and tell you their whole life stories for some reason. We're just those people. We're special, right? We're totally special. So thank you for that. Beautiful, beautiful. Nico, what's up? Thank you.
Hello. So,
Hi.
my group included me, Sandra, Mars, and Stucco. We did talk about a few different things because as we were setting a plan, we kind of talked about how it could relate to really anything. But we mostly focused on addiction, whether that's like food or smoking. And so what we talked about was like sitting down with them and kind of laying out a plan of like, okay, what are hobbies or things that you genuinely enjoy doing? And then, so when you are in these moments, like, also talking about triggers or like, okay, when you do feel the urge to do these like maladaptive behaviors, why that is. And we thought it might be good to create a list of hobbies and things that you can do and label it based on effort. So if you have low effort days, picking low effort hobbies. And I know Mars really talked about small steps. And so like, for instance, like with smoking, it may not be realistic. So like we talk about harm reduction, it may not be realistic from one day to the other to go cold turkey. So to try to focus on smaller things like, smoking one cigarette less, or maybe, don't smoke in the morning, wait till after you've had whatever. So just focusing on small steps and really showing up to support them and find out what's really going on beneath the surface.
Ooh, that's lovely. That's really good. I love that. Oh, isn't this good stuff, y'all? We're here. We're getting a lot of info, a lot of tools to put in our toolbox. Thank you so much. I know I kind of do the world thing, but Mike, go back. Did I hear a cat meowing in your background?
Yeah, I have like 6 cats in my house.
I was just wondering, maybe they're jealous for talking to us, wanting our attention. I was like, and my daughter is saying that they have personality because she's like, you need a cat, mom. But anyway, that was a side note. All right, I know we should have one more.
Yes, probably had probably smoke, and I actually recommended that because that was something I had to deal with. So Ethan and I had experience with that, and we talked about the importance of validating and understand. He's in the process of trying to do that, and some examples of what can work, but then how to replicate that. And then we didn't come up with so much of a plan as just really talking to them about how to connect, like doing some motivational interviewing about connecting health, so that because that's what helped me. And to share my story was that I finally figured out I didn't want to go back to smoking because it affected my health so much. So really helping them to connect, them knowing that the health will make their life so much better. So, and I
Love
appreciated the gentlemen. They were so patient with me being late, and Ethan was so great sharing what he's struggling with. So thank you.
Oh, that's beautiful. I love hearing that. I love hearing that. Thank you. All right. Yeah, smoking. I remember that on one of my state board questions. Actually, the withdrawal from smoking is worse than withdrawal from heroin. I mean, that was that was one of my test questions. But then again, that was 2016. So things may have changed since then, but you know what I mean? But yeah, no, thank you. And those of you who haven't heard of motivational interviewing, it's a really good tool. I remember doing the Jumpstart internship, and we each had a big, thick book of motivational interviewing, and I had no idea what I was getting into, like I told you. And I thought, oh, cool, they're going to show us how to interview for jobs. No, it was it was a cool thing. So we'll go with that in another question. Zai, what's happening? Were you in a room?
Oh yeah, I was in a room. I'm just gonna ask, what did you say? The withdrawals of smoking are worse than what? I didn't hear you.
Heroin, the withdrawal from heroin.
Oh, okay.
Yeah. I was really surprised by that too, but nicotine is pretty gnarly. Yeah, thank you. I was a closet smoker. I'm like, with that situational stress every 6 years or something like that, it's really weird. And only when I'm driving my car is weird. I don't know. I wish I could have quit other things like that. It's very strange. But all right. I think that's everyone, right? Am I missing anyone? I think we went through all the rooms. Sweet. Yoo-hoo. All right, let's keep going. I see somebody yawning. I better get snappy. Do we need to stand up and do some jumping jacks or some cheetah flips? I like doing cheetah flips. But anyway, you don't want to see me do a cheetah flip. All right, let's keep going. All right, this is good stuff. So you see how we could share with each other. We get ideas, we could share with others and empower them and educate them. And with education, that's power right there, baby, right? Just being educated and learning something we didn't know and applying that it's a beautiful thing. All right, let's keep going. All right. So now we're talking about that, being activated, right? Being activated with something going on, and then being able to have that self-management by having our own coping, what helps us to de-escalate and, get back on track. All right, so let me share with you. Y'all see my screen? Yeah, cool. All right. Fantastico. You are so big. Trying to make it. Sorry.
Did you say something, Renee? Or
No. Oh, you're back. Hi. You scared me.
oh no,
You just kind of popped in. Woo. All right. So behavioral X, it's not about me making life meaningful and pleasurable again. It just takes steps, right? We already know it's there. We just got to take those little steps. Like I said, I had to just put my freaking running shoes next to my bed and out the door before my mind goes, no, don't do it. So we got to learn about that vicious cycle. Be aware of that vicious cycle of inactivity, feeling like crap. And continuing that until we realize, hey, we got to activate. We need to take that jump. We need to take that first step. Okay. Monitoring daily activities. We saw that video, coming up with a schedule. I'm like a freak of nature with my schedule and my calendars. Like I have like 3 of them. Like I gotta, my lists. That's my OCD. But monitoring them, understand the relationships between our activities and moods. You could actually see where you're at, when you start, journaling or having a planner and just kind of writing a little blurt on how your day was, if you want to kind of monitor where you're at. And what's great is we're going to do safety and crisis planning. And actually there was an assignment that could help you out as well, to start getting an idea where we're at, like those 8 dimensions of wellness. Like, it's like, dang, where am I spiritually? Where am I financially? And that has a huge impact on everything. Like I said, mind, body, soul connection. Identify your values and goals, working out what really matters to you. What matters to you? What are the important things? What lights your fire? What makes you excited? What makes you smile? And simple activation, scheduling, carrying out those activities, right? Boost our experiences of pleasure and mastery, right? Make those lists, cross at least one out, and then move that list over the next day if you got to. But people that we're working with as well, the individuals, like we celebrate every little milestone, someone took a shower, I'm like, yes! I don't have to tie you on the top of my car and go through the car wash. He'd be like, no, but I could, there's individuals, certain people that you could joke with about like that. And so, but I was so proud of them, for doing that, or, just basic little things. I did a lot of work with ADLs, which is activities of daily living, showering, bathing, all that good stuff. So you have those, that behavioral activation weekly worksheet. And I want to show that. I don't know if I put in your packet. I think I just put one for you to fill out that I'd like to share with you. And I could even put it in here and give you these resources if you're interested. Actually, they'd be really good to keep these, have yourself a binder with all these presentations, hold on to this baby, because this stuff is gold later on, use these for when you're going to work with others. Mars, what's happening?
Before we continue, I wanted to piggyback on what you were saying about little celebrations and stuff. Even talking about it is a big step. It's a huge step to even, come forward and say, hey, I need help. That's strength, that's courage. So that is recognition, So that's the first spark right there, I
love that. And it's the little things. Remember, we're talking about let's not look over the little things, right? It's all about, that's so beautiful. I love it. So here are some tips. I don't think I gave you the packet. I gotta get you this packet. This is just a resource for you. You could also go online and download stuff like this. You see this worksheet here? Is it big enough? I see someone squinting. Hold on, let me make it bigger. Is that good? Okay, cool. So here we go. Making yourself a time schedule. you know, go and buy it. Like that's a good try. Again, if you don't do it every day perfectly, that's all right. You know, like celebrate if you did 1 day, 2 days, or at least something between 2 and 3. Okay, so here is something for you to work with. Also, you can use this to give away. Here's another one for behavioral, you know, giving yourself like, hey, this is another way to do it. However, you know, everyone learns differently. This is another way, like just a weekly sheet on, you know, giving yourself a little goal. And then we have this, which I will give you, and this is a whole action management guide. So this will give you all kinds of good, yummy information. You know, some questions, eating healthy, restful sleep, all this good stuff. Okay. So there's that. I will make sure to give you all that, and I will put that in the portal for you. My apologies if I didn't put that in there. Okay, so now going back to our role as a peer support specialist. Let's see, where am I at? My Zoom share. Okay.
There you
Thank you. So a peer support specialist provide individuals that we're supporting with a range of activities. We just heard some all self-care tools and resources, and the tools and access to range of activation. So these tools can help them, you know, activate and help them in achieving, you know, their whole health goals. And it's getting to know that person because everyone's goal is different. So you get to know that person, see their likes, you know, that's a good idea when you're meeting someone. Hey, let's write down what kind of things do you like? You know, I'm always making connections with music. When I see something on their shirt, I go by that. If I notice they got a cool color, they got an animal, whatever it is that you can get a segue in their conversation. All right. And with that, I'll also show you some more resources. So staying mentally healthy, right, for ourselves and also sharing this with others. I'd like to share this resource with you as well. Tell me if you could, I can't see anyone. Carlos, can you see this? Did it go to my screen? Right? Okay, yeah. So here we go. This is a website that you could go to, and actually this is, you know, you could do this with yourself, family members, whatever. You can use this for your you know, individuals that you're going to be working with, consumers, clients, however you're going to call them. We like to call them, I like to call them members. But here we go. We got a depression test, AD, bipolar, PTSD, right? This is something that you could just check out, answer these little questions here, and then it'll kind of wrap it up for you. But this is a really good resource, and I will actually, I'm going to drop that in the chat right now for you. Hold on to this baby, mark it. Good resource. I love resources. I geek out over this stuff. There you go. Okay, cool. So now, all right. So that's how we could stay mentally healthy, right? Emotionally, mentally. Yoga. Anybody do yoga in here? Dabble a little in yoga. Yeah. Wait, so don't mention yoga with Guyton, right, Carlos? Just kidding. Inside joke. Until you see Guyton's presentation, you'll know what I'm talking about. Now that Guyton's really cool. He just bags on me on yoga a little bit. All right, here we go. So you heard me talk about compassion fatigue. Am I sharing my screen? I am not, right? Okay.
Negative ghostwriter.
All right. So my apologies for the dead air. My trainer, Joe Ruiz, man, if you got a chance to meet him, he trained me, and it's like dead air, no dead air. Like, anyway, I'm going off. I had too much coffee. Anyway, compassion fatigue, the emotional residue or strain or exposure to working with those suffering from the consequences of traumatic events, right? So basically, that's the long-term exposure working with people that are suffering from trauma. I know, Maggie, you shared, especially, you know, working with foster children, like whatever it is, it's hardcore, working in a domestic violence shelter. I knew working on the street because when I was doing street medicine, I was dealing with the most vulnerable population with severe mental health issues that had been homeless with the unhoused for 10 plus years. Okay. We were like a hospice on wheels pretty much, because with the most vulnerable, their health issues were terrible. So by the time we got them housed, they would pass away. So it was, it was quite interesting. So I had to take really good care of myself and our team. So like within 2 months, we lost 8 people one year. And we knew, like, everybody, instead of doing a group text, hey, someone passed away, or I found someone expired, we would let the supervisor or the director know. And what we would do for everyone to know is we'd put a leaf on the door. So when you came to work and you saw the leaf on the door, you knew someone had passed away. And it was just a way for us to all take care of each other. So that, that's where the compassion fatigue comes in. And for you take care of yourself is so, so important. Yes, Jose, right? I mean, we're going to take on, if you're empaths like me, which most of you probably are because you're here, right?
Yes.
Jose, let me hear you. Tell us, tell me what you're shaking your head.
Yes, professional. Placing something on the door is an actual done deal with the different entities that are to be involved. Yes, thank you.
Oh, thank you, Jose. I appreciate that. And then this is where the burnout comes in. And we think of burnout, basically the burnout is the part that we have with work, our productivity, our billing, our documenting. Yeah, we do this work, but there's also the admin stuff where we got to make the money, right? So that's the accumulated, right? Emotional exhaustion on top of having that fatigue, man. And then going a workload increase, like that's not trauma related, but that's compiled on top of the work that you're doing. Like I know 2 people that I could not work with in the same day. Okay. One, it would take 45 minutes for him to calm down, just interacting with him. And then, this was like, the neighbor, the manager is not, he's an imposter. He molested my door. Like people are doing this and that. Like someone's, things that were like, ooh, like really, yeah, Ryan. Mayhem, like really, it would, and then he'd cuss me out, F you, blah, blah, blah. And I'd just be like, oh my God, there's so many times I was driving home crying, but you know what? I can't take that personal. Take care of me, go for a long run. Carlos, like, you know what I mean? And my whole outlet is doing like long distance running. Like I'll be out there for a couple hours and it won't even faze me because there's so much here that I'm just like, woo, let's get this out. All right. You still see me. All right. So we get an idea between compassion fatigue and burnout. Okay. Take care of yourselves. So workplace wellness, enhance your awareness with education, except where you are on your path at all times, right? We just got to say, hey, I like to say that I'm exactly where I'm supposed to be. The universe has this exactly the way it's supposed to be. And I just got to accept it, just breathe in, breathe out. Let's keep trucking. Clarify your boundaries. What works for you? What doesn't work for you? Talk to your team, right? And even like, with my members, hey, don't talk to me like that. I love you. You know what I mean? Like, I'm not here for you to abuse me. I'm here to help you. And, let's come up with a way where you're feeling agitated. Like I told you, the lady, she gets so freaked out and yell at me and cuss at me. And I'd be like, And then so we figured out a way where I'd play some Sade for her. And she would just turn into a totally different person. It was pretty cool. There was another one. If I played classic rock for him, I've never seen anyone play a freaking air guitar like that ever. It was so awesome. Like I was just like a different person. You find something that they just love and enjoy and you use that, right? We're talking. Anyway, take positive action, right? To change your environment. I think it was it Mars? Someone shared about, just taking them out of that intense stimuli and take them for a walk. Go look at a tree. Let's take off our shoes and stand, barefoot in the grass and look at me like I'm crazy, but they do it and they're like, wow, this is helpful. Limit the amount of daily news you watch or read. We talked about that. I'm so proud of myself. I ditched social media for over 6 months. And let me tell you, I'm doing a lot more reading, a lot more writing, a lot more art. Like it's incredible. It's a good feeling. So and that, that could suck you in and make you feel funky. What do they call it? Doom scrolling. I don't even watch the news because I'm so sensitive to everything that I literally get physically sick. And that's me. Be grateful for what's good in your life in the world. I know I would sit with people. That was something I also use is let's sit down, write 5 things that you're grateful for. Oh, no. Well, wait a minute. You got me. No, just joking. But you got food, you got a roof over your head. I start with the basic simples, and they're like, oh, yeah, let's start with that. It's not so easy to write 5 things that you're grateful for. But when you sit there and write them down and you look at them, it's like, damn, how can you not be in a bad mood? I had a sponsor that made me do 25 things that I was grateful for every time I talked to her and bitch and moan. I'm like, oh, no. But let me tell you, it does take you out when you can look and appreciate what you have. How about when we get sick? And then when we're not sick anymore, we're like, whew, man, I really appreciate my health now, every time. So anyway, show compassion to yourself by being kind, soothing, and comforting yourself. And that's okay. Some may say it's selfish. No. You're taking care of you, baby. So I want to hear, what are you going to do for self-care today, peoples? I want to hear it. Ooh, Carlos, what are you going to do for self-care today?
You're going to laugh, Renee. I'm going to eat a burrito. I'm going to eat a burrito.
Dude, there's a thing
This
with
is a running
hummus
joke,
and
y'all.
burritos. My goodness, this man. And he even had a burrito on his desk one day, and I was like, it had a tag on it. Who said that? And they're like, I didn't know burritos have tags. It was, what was it? You're laughing. What was it? It was a freaking
Carrie got it for me. It was a gift toy from my dog, Mama's.
but it was a burrito this big. We're like, holy cow. You always see this guy with a burrito. It's funny. Jessica, what are you going to do for self-care today?
Today I started working on this art project. It's a bracelet, so I want to work on it later today, and I want to be able to take a short walk. I love walking.
Yeah.
I do 10 miles a day, but I think today I'm only going to do 5. And I actually want to make Cheez-Its again today because that came out really good, so I want to do that again today.
Oh, I so love it. That sounds like a fun day. Thank you. Nico.
Yes, I love
Evie.
that.
Yeah, it's great.
For me, what I'm gonna do is I have a shrine for like dedicated to my loved ones and like with pictures, people who've passed. And so I'm going to go to like Walmart or something and get some photos developed so that I can add to it. And then I'll also be going to the park to play pickleball with the seniors later.
I love it. I still have not yet played that. I hear it's really, really fun. All right. Evie, Mike, Mayhem, Angie, Latte, and then Maggie. See if I remember that order. What's up, Mike? What are you going to do today to take good care of yourself? Let's hear it. Oh, Evie. I'm sorry. Yeah, Evie and then Mike. Go
Sorry.
for it.
No, I just saw that it was a nice day today, so I'm gonna go outside just because it's been so hot. So I've been avoiding going outside,
Mm-hmm.
but it's finally I need to get some sunlight, so that's what I'm gonna do.
I love it. Thank you. Mike.
Pretty much do the same thing as it. Even walking my dog today, get some sunshine. I haven't walked him for a few days, and they're getting antsy, so that's what I'm gonna do.
Oh, I love that. Thank you. Man, if that's something to get you out for sure. Is having a pet. Thank you. Mayhem, what are you going to do today? You going to cause some mayhem? Mm-hmm. That was so lame. I'm sorry. I'm a little corny.
I need to stop the mayhem and I need to be more kind to myself. I love the entire interaction today and just recognizing sometimes where I can be at. And so it's time to finally say, I'm going to go and take a drive. And I'm going to go look at some properties. I got out of a big mayhem of stress, of financial, I call it slavery,
Ooh,
enslavement.
I've got to write that down.
Financial slavery. And it finally broke. So this curse is out and it's time to look for bigger, better pastures and plan.
Oh, I love that. Thank you for that. Man, I can't find my reactions, but I dropped the bombs right now. Thank you. Angie, Latte with her fur baby, and Maggie. And then Maria.
I was going to read this 78-page report about myself that I was sent by a human design specialist, and so he says I'm super unique, and I don't know what he means by that, so I'm excited to read it and hopefully find out a little bit more about myself.
Oh, I love that. And that's so brave. I can't wait to hear tomorrow. I want to pick your brain if you share. That's exciting. Thank you. Latte and then Maggie, and then we'll keep moving.
I'm going to do, and it's like before my time, but I love it anyway. I'm going to do Richard Simmons, Sweating to the Oldies too.
I so love that. I haven't heard that name in so long. I have to share something. I know I talk a lot. But anyway, when I was little, like 6 or 7, I went to one of the recordings. He used to be on TV doing his little aerobic classes, and I went with my mom and my Thea, and we were actually recording. I got to kiss him on the cheek, and I thought it was the greatest thing. It was so funny. Oh my gosh. Thank you for sharing that. Woo, you just brought back a memory. Maggie.
I'm gonna take a drive to the mountains today with the husband, and I'm gonna go look for deers, and I'm gonna go look for little wild animals, and just kind of look at them from afar and enjoy that. And I'm gonna sing in the car. I'm gonna have a karaoke situation in there.
I love it.
I love to sing. I really do. When I'm having a really rough time, I want everybody to get the hell away from me. I put on my headset and then I just go separate in a room and I just sing. I just sing to let it all out and just enjoy it, you know?
Oh, I love that. I so love that. Oh, I love being in nature too. There was someone else with the hand up. No? No. I thought I saw someone else that put their hand down. Okay, cool. Thank you everyone for sharing some good stuff. Really good stuff. All right. Thank you for sharing that. All right, quiz time, baby. Quiz time. Woohoo! All right. A consumer thinks their diet may have a negative impact on their mental health. What can the peer support specialist do to help? A, ask the consumer about their interests in seeking a nutritionist for assistance. B, recommend that the consumer start taking a daily multivitamin. And C, educate the consumer on good nutrition and healthy cooking habits. Drum roll. Let's see, I'm looking at the chat. All right, let's check it out. And the answer is A. All right, we got some A's in there. Yeah, we got an A with the question mark. Yes, you were correct. It was A. Remember the components. Yes. All right. How many? Okay. So this is really cool. And I'm going to go through this with you later. I really want you to marinate in the experience, the state exam. That'll come later because right now you're like living the state exam, I would like to say. But so KSA stands for knowledge, skills, and abilities. And we have a test prep guide and it has a blueprint. And we're going to go over all of that. But there's 8 dimensions, right? And so it's going to be in dimension 1 under administrative responsibilities, which is KSA number 1, collaborate with multidisciplinary teams to coordinate care, right? So basically we're going to coordinate care by linking them to a nutritionist if they're interested. Let's go back to A. Ask them, right? We're asking them if they're interested in seeing a nutritionist. Okay, so basically that's where we're going to collaborate with our team, right? And we're going to, because our scope of practice, right, refer them, hey, you know, we have this. And it tells you the rationale because we're working with with teams with additional tools so they could collaboratively work with your team. And we have specializations that will improve the outcomes and help them out a little more. So in this situation, the consumer flags a concern, diet, nutrition, that is not within your area of expertise. So you collaborate with the team to make a referral on the consumer's primary physical health physician and address their concerns. Everybody see that? Woohoo! Yes, I see nodding heads. I love it. If not, you know, let me know. Jess.
I wanted to mention, I think a lot of the stuff that we went over today, first of all, it's very informative. I know today we went over the inclusion and strengths and the person's choice with growth and everything. And I think it's really interesting that even though those are like it's not a small factor, but it's like a very large factor in a way because those are almost like the principles that just have like this big umbrella of everything. So even when you were reading the question, I was like, okay, wait a minute, that's kind of including some of the stuff that was yesterday with stuff. So I thought it was like really cool.
Oh, I love it. I love it. And you'll hear that when we have our alumni panel. Oh, it's a big one. And I actually put it, I'll give you the acronym to remember. It's PICS. Is it person-centered? Is it inclusive? Is it collaborative? And is it strength-based? So you see how using that key, and I tell you from the beginning when you're answering these babies. Nico, thank you, Jess. I love that.
Yeah, I was just gonna say something similar to what Jess had shared, but I think even when you don't know an answer, something that's really helpful is like if it's instructing someone to do something, that's not always the most helpful. So if it's something that asks them like what they want to do, what their preference is, it typically is the right answer.
Oh, I like it. I like it. Carlos, what you got?
Someone asked if you can please repeat the acronym what PICS stands for, please.
Oh, yes. PICS, P-I-C-S. First, you're going to, okay, person-centered. Is it person-centered? Is it inclusive for the I? Is it collaborative with the C? And is it strength-based with the S? Yeah, baby. I love it. And we've had several alumni come back, and when they took the exam, you know how they give you a scratch piece of paper to go ahead and make your notes or whatnot. So they're going to give you a whiteboard. And what I've suggested and what's worked is right away write PICS on that whiteboard. Write it down on that whiteboard so it's next to you when you're on the computer answering the questions. Is very, very helpful. That's a gold ticket right there. That's a golden ticket. Anyway, thank you very much. Ooh, we're got good timing. Thank you everyone for engaging. This is really beautiful. Thank you. I hope you enjoyed it. Let's do our evaluations. Let's take a 10-minute break, and when we're going to switch gears, and we're going to do self-disclosure 1 with Mr. Carlos Alvarez. You're in for a treat. So thank you, everyone.